Okay.
Anyway.
So let's just go straight into it because we've got so much to cover.
Yes.
Caregivers today, huh?
Caregivers, and I was a bit ambitious and I wanted to put site testing in, and I was like, ayo, cannot. So we'll try and see how much we can cover then.
Okay. So if we're talking about caregivers, I guess we should sit down and figure out who caregivers actually are.
Okay, let's talk about the caregivers. So who are these caregivers that you're talking about, Jerry?
I think last week we were talking about the parents, right?
Yeah.
Parents of like special needs children and, just parents in general. But children looking after the parents, those with dementia, those who have some sort of illnesses, volunteers who go to the hospice. I hear that a lot, and they have their hearts in the right places and they give so much, right? So they are also one of the caregivers. Our domestic helpers, there are lovely domestic helpers that give, and they too can get a little bit stressed or burnt out. The allied health or the healthcare workers, those we know and those we have experienced how much they care for the nation also, not just each a patient. And I actually put in 2 more. I know I sent you 5, right? But I actually put in 2 more as I was coming to into the center today. One would be your superiors, your managers. Although we complain about them and everything, but the caring managers or the caring bosses are actually quite stressed because they look after everyone's well-being. And the last one was, I don't know, this one I will leave it up to you all to think about it. But I thought like members of prayer groups, whatever religion it is, I think they really put in a lot of emotion and to dedicate their time and effort to pray for whoever that needs prayers. What do you think?
Yeah, that helps.
Actually, that's a very interesting definition for a caregiver, members of prayer groups. I got to be honest, I have never thought of it that way. That is very, very interesting.
Yeah, because I was thinking about it because these people, the one thing that they have in common is they invest their time, they invest their effort, right? And the other thing is where we know burnout occurs is when they emotionally invest. And many of these people from the prayer groups, they really feel for those that they are praying for, don't they?
Yes.
True. Very true. That is an interesting one, that one.
And I feel in terms of their state of mind, they're also clearer. Because, in order to help people, right, you need to have a certain strength.
Yes.
Because it's easy to talk about like caring for someone and all that, but until you're in that situation, right, you won't know whether it's going to affect your mental health, whether it's going to affect you emotionally as well, because you might not be emotionally strong to actually witness certain things. Some people may even fall into depression after trying to help or care for someone who's in a certain state. You know what I mean? So I believe it's not for everyone.
I think being a caregiver takes a very specific type of person, and I've often wondered whether I could do it, and I don't know.
Try lah.
I don't know. I really don't know whether I could do it. I'm just being absolutely honest.
Let's throw FD in there.
Well, some make their choices, right? Like some of the helpers, they know exactly that they're going to look after the elderly or the infirmed. The healthcare workers, they know that they've made that choice. Crisis workers have definitely made their choice, but some of them did not make their choice. One would be the children. One would be the parents, or even a spouse that looks after, the other spouse. They didn't make that choice.
Right. Okay, we're talking to Dr. Geraldine Tan from the therapy room this morning. We continue to talk about caregiving live on Facebook, okay? And I'm looking at FD right now, and, you look very much like a nurse to me.
Oh, thank you.
Here's
Wow,
new
I look
order
like a nurse.
with regret. Yeah, can't you picture FD as a nurse in the hospital?
He's
Like a male
looking very
nurse.
serious today, actually.
No, I just that threw me off. Me as a nurse.
Yeah.
I think you can.
Oh.
You can.
I've spent my life bringing up 4 children. You think I want to look after anybody else?
And this like a
No, no,
surgeon lah.
I like the image of FD as a priest.
Yes, right?
And he can give blessings to those in hospitals and in the hospice. I like that, actually. That's a nice image.
Yeah.
The life I've led. Don't know whether the priesthood will take me.
Maybe not now, lah. Now it's impossible, lah.
Your retirement plan.
Now it's impossible.
He's a
Yeah, but
very, very good-looking priest.
Oh, thank you.
yeah,
Thank you, Ivan.
he's got the look, right? He's got the charisma. He's got the voice. He has the clarity as well. Unlike some of the priests these days, I don't understand what they're saying. sometimes.
Glenn, stop it. You're terrible.
God bless them.
Send them to Toastmasters.
Aiyo.
Where are we going with this one?
That's it, but I gotta go for confession now.
Tell me about it.
Father, forgive me, because I dissed some of the priests on the radio.
Come on in the newsletter, no?
Okay, now FD have to absorb his sin.
We've got a comment,
Throw water.
Jerry, just to let you know, from Dave. He says, thank you for presenting this topic this morning. Burnout is a real issue for caregivers. I have
Yes.
been doing home dialysis for my dad for 6 years. Burnout is real.
It is. It is. So let's look at the types of caregivers. Then we
Okay.
can understand why they are burned out.
Yeah.
Okay, I've got 5 different types of caregivers. Okay, the doers, those that hover, do and do. You want. Do you want food? Do you want drinks? I need to adjust your bed. I need to adjust your pillow, and they are just hovering around the person. Okay, the thinkers are those that read a lot. So they will go on Google and read extensively. They'll research a lot, and they will intellectualize everything. And they will tell you. So anything you want to know about the medical condition, they will tell you.
Right.
And then I separated the warriors. So the thinkers and the warriors are slightly different. The thinkers would intellectualize everything. And by the end of like a month, they are like the encyclopedia for the medical condition.
Right.
Whereas the warriors are worrying all the time. So they worry about this, worry about that. Is it too hot? Is it too cold? Down to tiny, tiny things to worry. And then there are the followers. So the followers will just do whatever that, someone says. You ask me to do this, I do this. You ask me to do that, I would just follow through with all your instructions without thought. And the last one are the listeners. So the listeners, it's actually quite crucial, yeah. The listeners will sit there with the patient and listen to them talk. They won't do anything. They won't worry. They will just sit there and then listen to the people talk. And the best use for them is actually in the old folks' home.
Yeah. Okay. Because they will talk a lot in there.
The elderly have a lot of stories to share.
Right.
And a wealth of experience, and they need the listeners. So if you're a doer, sometimes they feel a bit neglected, even though you do a lot. So the caregiver can feel unappreciated because they feel that they are not as appreciated, and the doer is not as appreciated as the listener.
But I think that's the case across the whole lot, isn't it? I think so many people feel unappreciated for what they do. Generally, caregivers, because how many people actually stop and go, "Thank you"? I think that doesn't happen enough.
No, so caregivers are really, it's a thankless job.
Yeah.
Yep. Yep.
I
Few
think
people come back to
I-
you and say thank you.
I think I'm a good listener. I can be a caregiver who's a listener. FD cannot.
I cannot.
He will interrupt people.
I will interrupt people
Yeah, he
all the
can-
You're
time.
so
Yeah.
big, but still
He
interrupt
can't.
people.
You know, he will interrupt people.
I will.
But I think I can do that. You know, I can just listen. Just listen to someone.
That
I'll
is-
just stick my hand out and then say, I've got a question.
Do you have a question right now, Ivan?
No, actually, I want to actually follow up with what FD was saying. I mean, I think, yes, you're absolutely right. And I think the crucial thing that as be it caregivers or if you're actually helping out, we have to recognize the signs of burnout and stress. And that's something that I want to ask Dr. G.
Yes. So the whether you are any one of these five, and actually when I categorize things like that, you cannot just fall into one category. There's always a mix of different parts of all the five in any one caregiver. So for those that goes, yeah, but I cannot fall into one specific category, don't worry about it. I was only teasing because I know that when I give the types, the boys will start looking at which one they are, as they always do, and
Yeah.
they did it.
Yeah. So Glenn is the listener. I am definitely the warrior. I will worry about everything because that's just the kind of person.
Warrior, not warrior.
No,
War-
warrior, not warrior.
You know, I'm a warrior too, actually.
Yeah, you are. Even
Yeah.
here at work, you are.
I am a warrior, actually. So maybe I'm not that good a listener, actually. Do I keep quiet most of the time, FD?
Are you joking?
Okay, then. Okay. Okay,
But
next.
anyways, we're looking at what drains them. So it drains them emotionally, mentally, and physically. Did I get the red card?
We'll take it from there. We'll take it from there, Jerry.
And
Going back on
I
air.
am a shower. So I
We've got Dr. Geraldine Tan from the therapy room with us. Today we're talking about caregivers. And what was your question, FD?
No, but we were talking.
Was it your question?
No, we were talking about how, and I just want to go back to it. So you gave us various categories, and you said that we chances are as caregivers we do not fit into just one category.
Yes.
Yep.
And then FD said he's a warrior. That's
I'm a
right.
warrior.
So you said he's a warrior, and then Jerry, you were saying something?
Yeah, I was following up on Ivan's question.
Yeah.
Right. And then you got the red
What-
card. And after we said, okay, never mind, let's just talk about it.
signs.
What are the signs? Okay.
science.
Yes, and I wanted to go into the emotional, mental, physical sort of drain that, caregiving takes on a person. And the emotion part, and I would invite all the listeners to, just chime in. One would be guilt. So if you're a warrior, the warrior is not just worried about nothing. They feel very guilty. If I don't do this or if I don't do that, what will happen? Do the same thing. If I don't do this, don't do that, what will happen? And then they get very angry that maybe progress is not good enough. Angry that they can't do more. The helplessness set in. And if it continues to perpetuate, right, depression. So FD, exactly what you said, depression can set in. Yeah, no, actually it's not FD. We're getting all the people mixed up today. It was Glenn.
Why? Because I'm a warrior.
Depression setting in.
Depression.
You mentioned just now.
You mentioned it.
Who is depressed?
No, you
No,
mentioned that people who take on this worry, they
Oh,
sometimes get
yeah,
stressed.
that's right. Yeah.
That's depressing.
Glenn,
I-
where are you? Which planet?
Yeah. Okay. So I said, caregivers can get depressed
Yes.
if they are not, emotionally and mentally strong. Yeah.
Yeah.
Okay. Just in case people think I'm the one who's depressed right now. Okay, go ahead, Jerry. Sorry.
So the emotions are there, right? And yeah, let me see. So burnout. Let's go with stress first. Stress. So we look at how caregivers can be stressed. So if any of you identify with that, yeah. Irritability. So anger, right? Just now I talked about. So irritable. You're just lashing out at people, a lot of anger outbursts or emotional outbursts. Emotional outbursts can also be, suddenly just crashing and crying alone or when someone asks you something and you just break down and cry. Yeah. Sleeplessness, because you're on call perpetually 24/7. You feel that you're on call, so your body goes into that high alert mode. And we see that very often with caregivers that look after the elderly, because the elderly would need to go to the toilet quite often. Those with dementia who have no concept of time. Okay, so the helper or the caregivers would be on hyper alert because anytime the elderly or the infirm can call you and you need to respond. If not, sometimes they fall down and then you feel guilty again. The weight changes, so it mimics a little bit of that depressive signs and symptoms. Yeah, so weight changes. Sometimes they can lose a lot of weight because of all the activity, all the worrying, or weight gain. You comfort eat, and then you start eating a lot. And you don't pay attention to your diet, grab anything that is available. You don't exercise, so the weight change can be there. Because of caring for whoever the patient is or the person is, you isolate yourself. That means you stop going out for social events. You don't feel like, and many times they would say, I'm so tired, I don't want to go out.
We know people like that. I'm sure some of us,
Yes.
we have people like that in our lives. What can we do to help them out, Jerry?
Well, there are different groups, support groups out there. So depending on the disorder or the illness, there are support groups that reach out to these caregivers. There are Caregiver Alliance, and that coach these caregivers and bring these caregivers together. But again, all these need time, and the caregiver must carve out some time for themselves. The closest one would be reaching out to your own family members.
Okay.
Yeah. So,
I think
No, go ahead.
that's good advice because
Yeah.
I think there are caregivers obviously tuned into us right now.
Yeah, but reaching out to family members and all that's great if a member of the family is the caregiver. But you've got to admit that a lot of the caregivers in Singapore are people who are brought in. They don't have family here. Where do they go? We hire domestic help, but we also hire these people as caregivers.
Okay, wait, hold on. Hold that thought. We'll continue to talk about this live on Facebook. It is 8:19.
1FM time check by
And
So
we're back.
getting back to it, I understand there's support groups and being able to go to the family, but like I said, some people hire domestic helpers who double up as caregivers for the elderly in the home because the younger ones are out earning money. Where do these people go?
Yeah.
They don't have family
Which
here.
is why we're talking about two groups of people here. So what Jerry was talking about were caregivers as well who are caring for their parents, caring
Yeah.
for their family and all that.
Yeah.
So I think it's important. We'll stick to that first. So the people who are caring for their family members who are starting to feel depressed, okay, then they can turn to other members,
members
of their
of the
family
family.
to talk. Okay, so we've settled that now. So now FD is a separate thing again altogether. You're talking about the caregivers, the nurses and all that who have come from other countries. Who do they turn to?
You know what? I know caregivers here who are not nurses,
Okay.
and it must be even worse for them because
Yeah.
they're not trained to do this really. Where do they go? How do they handle it?
How come they're not
So
trained to do this?
Like you're talking about domestic.
Yeah.
domestic helpers.
Oh, I
right?
double up.
see.
They
Okay.
double up.
Then you must say domestic helpers lah.
Which I did just now. And so they double up. So where do they go? How do
So
they
I
handle
would-
it?
I would always encourage the any of the workers, right, to tell their employers or to tell their superiors. So I'm going to put them in a similar category for the healthcare workers. So the healthcare workers, the domestic help that you have, talk to them. If you're an employer, talk to them. So whilst maybe the healthcare workers have the colleagues to kind of download, I agree with FD, the domestic helpers might be a bit more isolated. So I would always encourage the employers to talk to them about it. How is the day? What did Amma do? What happened? Or Amma is at it again, or Akong is at it again. Yeah, so permitting them that space and a safe space to just talk about things, because they are human after all, and they put in a lot of care into their caregiving.
Yeah. Would I be right to say that these caregivers that space you're talking about must be an honest space, because they are humans and they are going to want to grumble, and you need to allow them to grumble.
Yes.
Yep. It needs to be a safe space. That's what I always call it. A safe space.
If I can share, my mom suffered for 15 years when my dad had a stroke. And all the points that you mentioned, my mom did suffer for it. Be it, stress, be it all alone by herself. I mean, I really, say kudos to my mom, who actually, pulled through for 15 years
Right.
when my dad had a stroke. So, I mean, the points that you mentioned is spot on.
So she must have been emotionally distressed
Yes.
during
Yes.
that time.
And I mean, I know it's a bad thing, but when my dad passed on, I could see that sigh of relief from my mom. Because it's back and call, like you mentioned, like 7 a.m. you got to feed him his breakfast, and to make things worse, my dad was paralyzed on the right side. He couldn't talk, he couldn't move. Everything my mom had to actually physically help him out, even to the toilet. And I mean,
Wow.
you know what I mean. So it's really tough for my mom, and wherever we could, as brothers and sisters, we would chip in and tell my mom, "Hey, why don't you guys go out for a break?" But she says, "No, I got to do this." So,
Right. And she didn't want to get a domestic helper to help out,
No.
or
No,
a
she didn't.
caregiver.
Yeah, she just wanted to do it by herself. I think she felt that was her duty as a wife.
Right.
Yeah.
So, kudos to my mom.
Right. Wow. How old was she back then?
She was almost close to 57.
Wow.
How do we help people like that who won't let go?
Yeah. The word is won't let go. You're absolutely right, FD. Won't
Yeah.
let go.
They have a sense of responsibility, and they have that guilt if they are not there, So, that ties them to it. So externally, what we want to do, so we are the caregivers of the caregiver, if we can look at it from this point of view. And it is important to then reach our hands out to them, because they don't know how to reach out. So, for example, one of my colleagues last year, he unfortunately had a stroke, and right now he's still in recovery. So during the initial phases, when he was able to go home, he was quite angry and irritable, because of the lack of movement and things like that. So he was lashing out at his helper. So when we realized that he was irritable, so I pointedly asked the helper who accompanies him to the center, and I said, how is he at home? Is he like that to you? So I was very pointed, and she got a shock, because you cannot talk bad about your employer, right?
Yeah.
No. You have to tell me, because it's all part of the recovery process. So when we did that, then she would come to us and say, he get angry, or he scold us, or he scold, and the domestic helper was very convenient to just lash out at. So when she saw that there was a space for her to articulate that, hey, something is happening and is couched differently, she was able to download because she was ready to pack up and go, you know. Yeah, and then of course we alerted, the family, and the family sat down with her and gave her a space also. So that was very important.
Okay. We're going back on air. Hold on. What a classic track from Blondie. Call Me on 1FM 91.3. Good Times, Greatest Hits. It's Glenn the Flying Dutchman, producer Shaun Tupaz, Ivan Ranton, and Dr. Geraldine Tan from the Therapy Room.
And this morning we're talking about caregivers and some of the problems that they go through, the stresses and how we can help them. I think one of the things that has stuck with me so far is the fact that we need to see ourselves sometimes as the caregiver to the caregiver. And I think that's very, very important because a lot of us, I am sure, if you're honest with yourselves, have gone, you're the caregiver. Handle it. Because I'm busy working, I need you to handle it. And,
Right.
and then they have nowhere to go.
No, and especially if your domestic helper is the caregiver,
Yeah.
I think family members, should look out for the caregiver.
Yeah.
Look out for the domestic helper who may not necessarily, be a trained caregiver, and from time to time, I mean, give them a break.
Yes.
Just so that they can maintain that balance, right, and not fall into depression or start to feel unhappy because they're only human.
Yeah, and I think a lot of us forget that every once in a while it's good to put
Yeah.
yourself in their shoes.
Even if it means letting them, get a day off on Sunday if they want to go to church, for example,
Yeah.
because that's very, very important.
Yeah.
Some of them feel like they're totally recharged after spending their Sunday in
Yeah.
church. So, whatever works for them. But I think please bear in mind that they are human as well.
Yeah.
And so you can't just get them to take care of whoever it is in your household, right, without a break.
Yeah.
Yeah, and a little appreciation goes a long way as well.
Yeah.
Yeah.
I think showing gratitude to people makes them feel appreciated and they thankful, and they
Yeah.
become emotionally more stronger.
Right.
In that sense. So,
It's not
yeah.
just the overtime pay or,
not just a
or
paying
whatever.
thing, but then
yeah.
appreciate them, tell them how you feel.
Yes, yes.
What else can we do for these caregivers, Jerry?
I think reminding them to take time for themselves. So I think it was a good reminder, like, you mentioned, or letting them go for the church service or mass, just going out to decompress. That is very important. I think one thing that we realized during the whole COVID period was the nurses were not taking enough rest. They didn't dare to take rest because how they put it would be, if I go on a break, then my colleague will have to take over and our workload is heavy enough. So nobody dared to take any breaks, although it was trickled down to them that, hey, please take your leave, take a break. But sometimes they forget that they should take a break. So when we tell them, oh, go and accompany us to do this or do that, then they remember to look after themselves.
Yeah.
Scheduling time for themselves.
Yeah, I think there are many caregivers who get very emotionally involved. I knew one. The lady has since passed away. Her caregiver was with her for close to 20 years.
Wow.
And this caregiver just became part of the family.
Right.
Yeah.
And when she left us, the caregiver then went into depression because she was in a situation where I got nobody to look after. This is all I've ever done,
Yes.
So she had a very different situation from most.
Right. Should we go into psychological assessments?
Do you want to? Well, we still have caregiver burnout.
Oh, okay.
Okay, so talk to us about caregiver burnout so that we can learn to recognize it.
Wait, hold on. Okay, so let's play a song and we'll continue to talk about this live on Facebook, okay? Here's Shanice, Saving Forever for You on 1FM 91.3. Good times, greatest hits. I just assumed that when we were talking about the caregivers who are like, emotionally stressed and all that, we're talking about them
Burnout.
burning out already. That's why.
No, I mean,
Sorry.
there's more.
Yeah, okay.
Yeah.
So
Let's go on then.
As
We can talk about psychological assessments maybe next week.
maybe next week, yeah. So as people who hire caregivers, how do we recognize burnout?
Okay, so you would see there are 8 points here. So one, they are not finding pleasure in anything. Everything starts to feel and look a little bit darker, a little bit bleaker, so a lot of negativity.
Yeah.
People are starting to ask, hey, are you okay? Are you okay or not? And then, if more people start to ask you, maybe you're sending some vibe that something is wrong, okay? And you're not recognizing it. Okay. The caregiver is not as productive. Productive meaning they are being a bit more careless. They're not as on the ball anymore. So they're having issues with people because irritable, right? So they're having issues with people around them and just lashing out. And then the intense anger, sadness, worry, and it's more intense than just usual I'm concerned for you sort of emotion. Sleeplessness, we spoke about the changes and everything. So all the stress symptoms are all there. Now this one is important. They start using substances to cope. So you see quite a number of caregivers turning to substances. I saw FD's face.
Yeah, because to me that is dangerous.
It is.
Because under the influence of substances, you are no longer able to focus properly.
No, maybe
Exactly.
they can focus better. That's the reason why they're taking the substances. What kind of substances?
Yeah.
So the typical one would be alcohol.
Okay.
To numb everything and to the reason is always it helps me to sleep. I cannot sleep otherwise.
Like what? Like a shot of tequila or a shot of whiskey or
A bottle of wine, maybe.
a bottle of wine?
Any of these substances, right? Substances can be like for the in the hospitals, we do have many accounts of doctors, nurses using the medication in the hospitals. Yeah.
Oh.
Yeah.
Wow.
But some
Yeah.
people will just smoke as well, smoke heavily, to de-stress as well.
Yeah, I know
Yes.
many friends who
Yeah.
smoke heavily.
To de-stress.
Just for fun, actually.
For fun.
Yeah.
You should stop.
Just for fun. No, we're talking about caregivers.
No, I know what you know.
here.
I know
Yeah.
what you mean.
Yeah. So when we start seeing an increase in the use of these substances, if you can catch it, so those that they take on the sly, we cannot catch it. But those that we can see, we can observe, then, even substances like food, suddenly they're taking more food. They're eating a lot more. We need to be alerted and say, hey, is everything okay?
Maybe they're eating more because they need more strength.
Yeah, no, that's the excuse.
Okay.
So, Dr. Jerry, how do you think we should foster resilience here when we talk about stress and all that?
Remember last week we talked about compassion. So giving them compassion. That's why I said that we are the caregivers of the caregiver. So all of us play a part. Giving them compassion because sometimes the caregiver gives so much they forget to give themselves a bit of compassion.
Right.
Yeah, and no, go ahead.
You know, I think this is going to be controversial, what I'm going to say right now. But perhaps maybe, we should look into only allowing qualified caregivers to take care of these people.
Spot on.
Because I think it's inevitable that a domestic helper who is not trained in that area will ultimately feel, totally unhappy because they're unsure, because they're not trained in that area. So they will feel depressed and eventually, you never know, they might just go crazy.
Well, we have seen, although in Singapore I dare say it's very, very rare, but we have seen abuse.
Yes.
We have seen it. And I'm sure, you read about it in the papers and it's all about the abuse and the person gets charged and, whatever the sentence may be, blah, 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 blah. But is anyone finding out why this happened? That, to me, is what we should be finding out. And when you've got studies like that, then you start to see rules come in,
Correct.
like you're suggesting, where if you want a caregiver for the elderly, that person must be trained to do that. If you have a person who is physically disabled and you need a caregiver, someone must be trained to do that.
Yeah.
That's the way to solve this problem, at least to begin to solve the problem.
Because anyone can snap,
Yeah.
after a while.
True.
Yeah.
Right? So if you're not trained, obviously, you are going to snap at some point.
Quicker.
So Jerry, are there places where, say, these domestic helpers who are looking after physically disabled people or the elderly or whatever, are there places where, as an employer, I can send them to get trained?
Definitely. So there are a lot of not courses, but little workshops here and there, by Caregiver Alliance, I think there is another caregiver place. And also in the community hospital. So once you go there, they have the STOT who are very willing to have the caregiver in the session to teach them homework to do when they are back home and how to manage. Yeah, so the resources are all out there. You just need to know to use them. So must use all the resources that are available out there.
All right. Hold on. We're going back on air.
In a bit.
We've still got a little bit of time.
Yeah,
Okay.
still a bit of time.
No, because I think before someone hires a maid, okay, I'm using maid because
yeah.
I just want to make it very clear.
Yeah.
Before hiring a maid, right? I think someone needs to assess about the person at home, right? The person at home, how ill is the person? What's the condition? And then see whether it's suitable for the maid to actually take care of that person.
Well, that's the second time you've hit the nail on the head, Glenn.
I like hitting nails on
Regular MC
On the head.
nowadays.
any size nail, small, big. El King! X's and O's right here on 1FM 91.3. Good times, greatest hits. It's Glenn the Flying Dutchman with Dr. Geraldine Tan. Good morning, Jerry. Once again, thank you so much for joining us every Tuesday.
Just a comment on our Facebook page on what Glenn just said regarding professional help. And I'm in total agreement with Glenn on this. But Fiona has come back and said, but for many, getting professional caregivers is just too expensive, which is why they use domestic help.
Okay, no, I'm not saying that domestic helpers, maids can't handle these situations. But what I mean is sometimes, right, it's almost a ridiculous situation, where the person that the maids are supposed to take care of, right, it's just impossible to take care of them.
Yeah.
You know what I mean? There are different levels, right? So someone should assess it. So before you approve of a maid taking care of this person, right? You know what I mean.
I do know what you mean.
Yeah.
Jerry,
Right.
here's a comment from a caregiver who's listening to us and watching us right now. I am a caregiver of my special needs boy. I didn't realize I had burnout, and I snapped and lashed out at my friends, and now I've lost my friends.
Oh no. Yeah, so this happens to quite a number of caregivers who have no choice. So these are one category of people. So at least the helpers have a choice. If they cannot manage, they can leave. But being a parent, being a child, being a spouse, you have no choice. And kudos to a lot of these moms who have special needs children, because they are on call, back and call, 24/7 from the day the child is born, literally. Yeah. So it is tough for them because they grow into the role, and it can be very subconscious when they are burnt out. So now that we know the signs and symptoms of burnout, reach out to your friend if they have a special needs child, looking after the parents, looking after his spouse. Yeah. And just tahan a little bit, maybe, when they lash out, instead of getting angry with them, we ask them, is everything okay? I think it's a very powerful question. How are you doing? Is everything okay? And sometimes that question can bring tears. I mean, I would experience that because sometimes it's so sweet after a session with a client, and the client says, oh, you've always talked to all of us. How are you doing in this pandemic period? Oh my gosh, my heart melts when I hear those questions. Yeah, because you feel taken care of also.
Your hand looks so small this morning, Ivan.
Sorry, Dr. P, you mentioned earlier on about ST and OT, special therapy, or is it occupational therapy? Speech therapy and occupation. So how can one learn all these courses if they want to actually teach their caregivers, or even for a person who wants to know more? How
So
do we go about it?
the general one, to look after themselves, to look out for certain signs and symptoms, those are the general one. So the speech therapist, the occupational therapist, the physiotherapist would then coach the caregiver on what are some of the exercises the patient can do. And and how much they can do, so not to over push them until they get angry and they're helpless, so that also can help them to moderate some of the patient's emotions.
All right, we're talking to Dr. Geraldine Tan from the Therapy Room. It is Therapy Tuesday right here on 1FM 91.3. Here's Elton John with Can You Feel the Love Tonight?
For those of you who have been listening to us and you're saying, okay, maybe I do want to help my caregiver a little bit more, Angela Chan has come back and said there's an agency for caregiver training. It's called AIC.
I'm really confused. We're just using caregiver for everything. I think we need to distinguish. Now, are you talking about domestic helpers?
I'm talking about anyone who is a caregiver. You need to be trained.
And a parent?
Yeah.
Yeah, okay.
Yeah, for example, okay, I'll use myself. I have my mother-in-law staying with me, and one of my biggest worries is as she gets older, she's going to need care, and I have no idea where to start. So now that Angela has given me AIC, I am actually going to check AIC to find out how I can prepare for that day. So it's not just the domestic maid; it's anybody who wants to be a caregiver. You need to stop and go. If I need specific training, then I should get that training.
Yeah, but you see, what I mean here is that you can take care of yourself if you're going to be a caregiver. You see, who's taking care of the maid? You know what I mean?
Yes.
What I'm saying is I feel like sometimes the maids are being abused,
Well, they are.
two positions like that. So that's why I'm saying we need to distinguish, you see. Maybe it's a topic for another day or whatever, right? But I think it's a very serious thing.
It is.
Imagine if you're a domestic helper, right? You're a maid, and all of a sudden you come to this country and you're taking care of someone who's a vegetable at home.
Exactly. And I'm not prepared for that.
Exactly.
I don't know how to do that.
Right. And you're not getting a break every day because, no one wants to take care of this person. So, this maid takes care of this individual.
And bear in mind that it's over and above everything else that she's doing. Yeah. I do understand what you're saying.
That's why I'm saying, you see, I mean, we need to...
Even if that is
To
the case,
distinguish.
if you are listening to us and you want to help your maid, it's courses like that will help her. The more she is trained,
Yeah, most of these people don't care about their mates.
I think the very
They just want to
first
get away
thing-
from that responsibility. Sorry, Jerry.
I think the very first thing, right, is to be upfront with the maid, right? That you are looking after someone that is bedridden, that may need more care, and are they willing? So giving them a choice right at the beginning is very important, because we give them a choice to come into a household, to choose, whether they're going to, can they manage a house that is 3 stories high, or can they manage just a small flat, or if the household has elderly or children. So we give them a choice, So why can't we give them a choice whether they want to learn to how to manage, these caregiving duties? Because when they choose, they're more inclined to then say, I want to go for courses. Can you send me for courses? I want to learn how to look after Ama or Akong. Yeah, I want to do all these.
Okay, hold on. We're going back with FD's question of the day.
yes.
Okay.
Glenn and the Flying Dutchman's question of the day is brought to you by Reach.
Okay, every morning we get together with the good people of Reach and we ask a question, and I thought, let's try this one on and see what Singapore has to say. What is the best thing about our education system in Singapore?
Wow.
Tough one.
Tough one, right? I'd like to hear what Glenn has to say.
What?
From your day.
I have no kids.
No, from your day when you were in school.
Okay.
What was good about the education system?
What was good about the education
Yeah.
system?
Yeah.
Yeah, I never thought of an education system as good, quite frankly.
Okay, that's fine.
I just want to get it over and done with.
You just wanted to be out of school and earning your money.
Yeah.
Interesting.
Definitely could have been better.
Okay. It's an
But
interesting
it's not,
question.
not fantastic.
Okay. Do you have any comments, Ivan?
I think it's better now, right?
I think it is. Personally, I think it is.
Totally agree with Glenn, but I think the education system, I think the first thing, it's affordable and it's high quality, and parents will do all they can to support their children, right? So I think our education system must have the buy-in of society, and particularly in Singapore, because parents, the kiasu culture needs to change in order to innovate. That's how I see it.
Okay, very interesting. Shaun?
I like CCAs. So I like that they are quite open to like ECAs and CCAs. Back in my day when we started school, I tried a lot of CCAs, and I just told all the teachers that I don't like fit in any of these places.
Yeah.
So they like, so what do you like to do? Then I told them dance. So they're like, okay, then you start the dance CCA. So we started a dance CCA, and then that taught me like responsibility, leadership, blah blah blah, and that kind of thing. So
Awesome.
Yeah, I like that they are flexible that way.
Okay, interesting. Jerry, you got any comments on the Singapore education system?
Next time, don't ask questions like that, FD.
Hey, these are questions that need to be asked.
Well, I like the fact that it's affordable for everyone, but it's affordable because they mandate it. It is it's mandated that all the children have to go. It's compulsory education, right?
Yeah.
So all of the children have to go through. But although it does look like they are imposing something, I think it's very important for the children to have an education. To start on life on the right footing.
Yeah.
So that one to me is good, and I like the fact that they are open now to evolve. They are more inclusive. So I've got journeyed with 2 autistic boys, and one of the autistic boys is in a mainstream school, and he did brilliantly. He
Awesome.
got best progress in one of the subjects or something like that. And we really fought very hard for him to come to this day. So very happy, that they are open and evolving.
Interesting. My take on our education system, if I can just say this, is I've always believed that it was a giant stew pot, a
Okay.
pressure cooker. And if you could work within this pressure cooker, you could work anywhere.
Okay.
That's always been my belief. When we come back, I'll tell you why that belief was proven true.
Right.
Okay?
I think if I had a kid, right, I would send my kid to one of the international schools.
Interesting.
That's all I'm going to say.
Interesting.
Glenn and the Flying Dutchman's question of the day was brought to you by Reap.
Okay.
Okay, so we're going to deal also with what our fans are saying on our Facebook page. Okay, before I get to that, let me tell you the story that proved what I said. In my mind, proved what I said was true. I was in Detroit many years ago, and I met. Well, not many years ago. 10, maybe 12. No, before. How long have we been working together?
19 years.
So 18 years, 20 years ago. I was in Detroit, and I met a president of the Foreign Students Union at a university. And he was a Singapore boy. And we got talking, and I went, so what's university like here? You know, you've come from Singapore. And he said, if I had not studied under the pressure in Singapore, I would not have been able to cope with not only studying at this university, but living the life of an American. He said that pressure prepared him for what he was going through now. Not the stuff he learnt, the pressure. And we all say the pressure is bad. It may not always be bad.
Yeah.
Just a couple of comments. You've sent us so many. Balbia says, there is something missing in our education system. If not, there won't be any foreign talents in Singapore. So she says there's something wrong. Winston says, not really. I hate it. In fact, he says, rote learning does not make learning fun anymore. It's more like a strategy to do well in exams. Just regurgitate. It is not impressive. Anybody agree with that?
No comments
No comments.
from me.
No comments. Maul says, I really do appreciate that Singapore has implemented a bilingual policy. Learning English as a first language together with an additional mother tongue opens up a lot of doors for us in adulthood. There are many, many comments, and I would suggest a lot of people go and read these comments. They're not all good. I will tell you, they're not all good.
I just feel sorry for my friends growing up, right? Some of my friends were not really good in English.
Yeah.
Okay? And they failed their exams because they failed their English.
I've often
But
wondered
they were actually really, really good students, and they were smart. It's just that they were bad when it came to the English language.
I've always wondered about that. Why is it that if you fail your mother tongue, or if you fail, in my day, if you failed your mother tongue, you failed,
Yeah.
right? Or if you failed English, you failed.
No, it was tough.
Why?
I don't understand that as well.
I don't get
but
it.
maybe they just had to have the system. You know, I almost didn't succeed because my Mandarin was really bad. I
Yeah.
worked so hard to get a D7 just so that I could
You could
move
scrape
on to
through.
pre-U. You know.
Yeah.
If I didn't get that D7, I don't know what I would have done.
Exactly.
My mom, my parents had no money to send me abroad.
Yeah.
So, you know,
Maybe
Well-
that is something we need to look at in the system. But thank you very much for all your comments. There are so many. I suggest as many people as possible go and read them. You can leave your comments on our Facebook page as well. What is the best thing about the education system in Singapore?
Done.
you know, I wish we all had the choice to take up another second language. Because I wouldn't want... Let me just say, I didn't like the fact that it was so hard for me to pick up Mandarin and do well in my exams. Malay, you know, I don't think I was, you know, I would have done well in Malay as well.
It's not as easy as some
But, you know,
people
I had
think.
friends
Yeah.
taking up like German and French and all that. I would have loved to take up either one of those languages.
Yeah, second language instead of a mother tongue.
Yeah, I don't get the mother tongue thing either.
Because even now, right, my Mandarin sucks.
It's okay. I know
I
about...
can speak a little bit.
I
but-
can remember about 4 Malay words because I don't use the language.
took
I've lost
Malay.
it. I don't use the language. I've lost the language.
I think it's just us. They just want us to maintain our identity somewhat.
Dr.
Yes.
Jerry, do you think all kids are working really hard these days?
I do think so. They are lovely. Our children are all lovely. You put them through the system, they don't know better, right? So they just work hard.
Okay, we shall sing a song called "Isn't She Lovely"
All right.
today.
Sheila.
No, go on. I'm just preparing the track.
Oh,
Jerry,
I thought you said that I'm lovely.
You are
Ayay.
lovely. You are lovely.
you are lovely, Jerry. That's why we have you on every week.
So we'll dedicate "Isn't She Lovely" to you today.
Yes.
Aw. Yes, and it's so sad because Shaun was telling me that there are 2 more weeks before you go on a break. Is that right,
Yes,
Shaun?
3, but yeah. So
Yeah.
this is the 3rd week lah. So 2 more weeks after this.
2 more weeks, right? Yeah.
Then you guys get a
So-
break too.
You get a break, a 2-week break.
But I'm gonna miss all of you.
Oh.
It's okay, not like we're going anywhere. We'll still be in Singapore.
Don't worry, Jerry. I'll hound you on your social media.
Yeah, you
Hey.
can still go on Google Meets and talk to us.
It's time to take what Jerry out, man.
We should.
Yeah,
As a
yeah,
big
yeah.
thank you, we
Fun.
should. We should.
Fun.
Yeah.
We absolutely should.
And I have to go in a little bit, but I'm gonna leave everyone with the Mother Teresa quote because we were talking about caregivers.
Yes.
Okay.
Yes.
Okay, so we talked about how difficult it can be. So I want to remind everyone, not all of us can do great things, but we can do small things with great love.
Nice one,
that's a nice
Jerry. Good one. Love it.
Thank you, Jerry.
And with that, I will bid all of you adieu.
Bye, Jerry.
Bye, Jerry. See you next week.
Bye. See you
Bye,
next
Jerry.
week. Bye-bye.
Bye.